Welcome viewers at Healthcare Today. Diabetic foot is a commonly used term for a condition of the foot in a diabetic people. But actually the diabetic foot is the end condition of a precondition of diabetes, that is diabetic neuropathy. So the care, if you have to take a neuropathic foot, because if you can take care of a neuropathic foot, then you can take care of a diabetic foot. When the diabetic foot happens, that means it's basically infected foot, it's a permanent ulcer foot, like that things. That is the end condition of your diabetes related foot complication. So basically, if you have to take care for your diabetic foot, you have to start taking care when you have neuropathy, that means diabetic neuropathic foot. Due to the diabetes, either it can be uncontrolled or a long duration diabetes, person's body nerve can get slowly damaged and neuropathy happens. And due to the neuropathy and some other things, the diabetes, the blood supply of the foot also get reduced and disturbed. Both these conditions, they precipitates different infections and ulcers of the foot, and also for neuropathy and reduced blood supply, this infection and ulcer becomes very difficult to heal. Basically this infection and ulcers of the diabetic foot. If you have to take care of these things, basically you have to prevent the formation of ulcer and diabetic foot infection. How you can do it? Very simple. You have to follow few simple rules and you can do it very adequately. Rule number 1, you should examine your foot before going to sleep every day, so that you know there is no new wound or any ulcer, any blister or anything, or any changes in your foot. Because neuropathy, if something happen, there is no pain sensation and you don't know what's happening. So that's why you have to check once a day, every day, the best time before going to the bed. Rule number 2, do not walk barefooted, not even within your house. Always use a shoe, and that should be a comfortable, loose fitted shoe. Do not wear shoe without any socks, and the socks should be a thick cotton socks. In diabetes, your sweating get reduced, so skin get dry, and dry skins are prone to crack, and cracked skin is the source of infection. So you have to keep your skin moist. So use moisturizer every day on your foot so that skin remains soft and moist. The diabetes also evokes different infections, and most common infection in the foot is the fungal infection. The fungal infection happens between the toe clefts. A moist toe cleft is the source of fungal infection. So when you are applying moisturizer, just keep in mind you should not apply it between the cleft of the toes. And after coming back from your washroom, you should dry your foot properly. You should change your shoe on a regular basis. Do not wear a old shoe, improperly fit shoe, that can cause a injury to your foot. We have a tendency to have a hot application on our foot during winter. That is very dangerous. Why? Because due to neuropathy, you will not be able to recognize when you are having the burning, the temperature that is not acceptable by your skin. So you will keep that hot surface along your body for a longer time, and that can cause burn on your skin. So very simple thing. Though you have neuropathy, your sensation is less, so you may not recognize the injury. So you have to taken care enough so that you don't have the injury, number 1. Number 2, if you have the injury, you should discover it early. So examine your food regularly. If you can maintain these things, you can avoid the catastrophic diabetic foot infection, and this is the way you can care of your foot. If this information is informative to you, please do share with your friends and family. If you have a question, please call us. We will answer your queries. We do care about you.